COVID-19 infections in Gauteng are approaching the 70,000 mark with over 400 deaths. President Cyril Ramaphosa has asked the province to make more beds available as the numbers rapidly increase. eNCA's Khayelihle Khumalo is following that story and joins us now for an update. And so, Kaya, part of what you've been doing is gauging the political inputs in as far as responding to the developing situation of COVID-19 in the province. But you've also been talking to some trade unions. What have you been hearing?
Well, obviously, most of the trade unions are really worried about the state of affairs. Others also, they are pointing to a number of concerns that are facing the healthcare workers. But also, most importantly, we know that the province has been ramping up its efforts in terms of making sure that they do have sufficient facilities. And in fact, the MEC of Health is joining us now to listen. So, MEC, obviously a litany of issues that you face. Let's get straight on the issue of the bedding space in Gauteng. Do you have the capacity?
The capacity is coming on. Remember that we've done 500 beds in Nasrec, and we are putting up extra 1,000 now in Nasrec. We are putting up another field hospital in Davidton, in Ekurhuleni, with the assistance with the South African National Defence Force. So these are field beds that are going to meet up with what we are building inside our facilities. You would recall that we are building over 1,600 beds in Chris Hani Bara, Kopanong Hospital, Jubilee Hospital, and George Mukhari. And all these beds will be ready by end of August, which when we combine them with the field hospital and the capacity that we would have done and created in our hospital, we will be able to actually serve, the wave and the peak.
And obviously, MEC, we had the President obviously also making a clarion call for Gauteng, the Eastern Cape, and many other provinces to make sure that they work around the clock in terms of making sure that the system is not overwhelmed.
Since the first time when the President came to our province, that's what we've been doing, and a number of work has been done. You will recall that last week Thursday we received 30 more ICU beds in Charlotte, and we are going to receive more beds in George Mukhari, which are a product of a repurposing and refurbishing of what we have currently. And these beds will continuously be coming in throughout actually July. The field hospitals, as they are coming through, they will also help us to close the gap where the patients that are stable, that require extra care beyond being actually stabilized, they will be going to the field hospitals where they will be taken care of. The other important aspect that we have actually also noted is also to create emergency and accident extension, where our departments, our casualty departments, because they've been clogged up with patient under investigation, the PUIs, those tents will be working also to decongest the casualties and give space actually for them whilst they are waiting for formal beds. Then they will be actually treated in those spaces. So this is work that is in action. We are putting them up, and we will be going around also helping and making sure that the staff that is also in the front line gets the support that they need and they get what is actually required.
Especially because, MEC, we've spoken to some unions like NEHAU and others. They're talking about a very sad state of affairs in terms of the overcrowding, in terms of the capacity. How are the hospitals doing currently?
The challenge has been there. We have been saying that we are feeling the stress and the pressure, and this is a pressure that comes with the winter season and also now added up with the COVID-19. And it's something that as the health department or the healthcare system, it's something that we usually absorb and be able to deal with it as it comes. Unfortunately, there might not be a perfect plan where it can be able to completely actually address all the concerns. But the most important aspect is for us to be able to adjust and also escalate and be dynamic in how we address some of the concerns and some of the issues that are there. In particular, the issue of PPE. PPE must be replenished at live time, and it should be reported when we are running short. It shouldn't be a point where people are forced to work without it. It's an important aspect, and that is the reason why we are even getting more and more and procuring more PPE as actually possible.
And just before I let you go, MEC, now the issue that you have been at pains to explain, hard lockdown and the issue around the stricter regulations in terms of the enforcement, how far are you with those plans?
It's a presentation we made to the NCC. It's a presentation that we actually compiled with the EXCO of the province. The most important aspect is just to create a delicate balance between opening up the economy and also with efforts of slowing down the transmission. And some of the regulations that are there should be enforceable. Some of the regulations will give us greater impact in reducing the rate of transmission. The one important one is on crowd control regulations, which is quite important because that's how outbreaks usually come out as sources of them, particularly funerals. Unfortunately, we can't avoid funerals, but those events that can be avoided, we should avoid them in the period of time, maybe towards September, towards the peak, so that people must stay home, only leave their houses when it is necessary. We also need to maybe introduce the curfew, to make sure that there's not much unnecessary movement, in our streets in Gauteng. The interprovincial traveling is a big problem because we have seen that some of the outbreaks that we have seen comes from the interprovincial traveling that we have seen. So when we talk about the lockdown, it's for us to adapt, take regulations from level 5, level 4, and adapt them and actually enforce them in a more strictest way. At the current moment, we can be able to apply a lockdown with insight, with experience, and we know which ones will give us maximum benefit.
All right, MEC, thank you so much for your time. So that's the Health MEC here in Gauteng, really talking about some of the tools that they are exploring as a way of trying to fight COVID-19.
All right, Khayelihle Khumalo, thank you for that update.